Thank you, Deepal, and I'm very honored to be here today. And thank you, Wendy, our president of Planned Parenthood, and your entire team that are working so hard on these issues. Delighted to see our incredible Attorney General, Tish James, who we're working so closely on this very issue with. We just got off the phone. I know that Assembly Member Jessica Gonzalez-Rojas has put her heart and soul into dealing with these crisis, basically a crisis right now as well. And great to see our Speaker, Adrienne Adams, as well. And I think we'll be joined by the mayor. But I want to thank, first of all, Planned Parenthood of Greater New York for everything you do, not just to protect the health and well-being across our state, but also the rights of our people. And when it comes to reproductive freedom in this country, we are right now facing historic, horrific setbacks. Just 1 year ago, women in this country had a constitutionally protected right to an abortion. And then in June, with the Dobbs decision, we are forced to confront a painful reality that the fundamental rights that my grandmother's generation had to fight for were stripped away with one decision. Now, the mega anti-abortion extremists, legislators and judges alike, are hell-bent on continuing down this path. They're coming after all forms of reproductive health care, and they took their latest step just on Friday with the ruling that'll further limit access to mifepristone and for millions of women across this country. One judge in Amarillo, Texas, thinks he knows better than thousands of doctors and scientists and experts, and not to mention the countless women who've used this medication safely for decades. So this isn't just an attack on abortion, it's an attack on democracy. Courts have never before revoked a science-backed decision made by the FDA. And if this decision stands, it could have unprecedented consequences that reach far beyond abortion, threatening the FDA's critical role in our country's public health system. So, this moment calls for bold leadership at every level of government. And I'm glad the Biden administration came out so strong against this ruling, and we've been standing shoulder to shoulder with them. And at the state level here in New York, we're not going to let one extremist judge turn back the clock on more than 20 years of safe reproductive care. New York has always been at the forefront of this fight. In the wake of the Dobbs decision, we allocated $35 million to reproductive health care providers. We mandated all insurance companies doing business in New York cover abortion. And I signed a package of legislation protecting providers and our patients. And last year, the attacks were on abortion procedures. This year, medication abortion. What's next? Contraception? Birth control? Well, I'm here to say, not in New York, not now, not ever. So last year, we called an extraordinary legislative session. We took one step closer to passing New York's Equal Rights Amendment. The ERA, as written, will enshrine abortion and contraception rights and protect all forms of reproductive health care in our state constitution. The ERA and these fundamental rights will be on the ballot next year. Once again, states have become the battleground on these fights. And one latest steps to tear down these rights have only strengthened our resolve. So I'm proud to announce that New York State will create a stockpile of misoprostol, another form of medication abortion. Extremist judges have made it clear that they won't stop at any one particular drug or service. So it's going to ensure that New Yorkers will continue to have access to medication abortion no matter what. We're also announcing that if this decision stands by this judge, we will dedicate up to $20 million more for reproductive health care providers beyond our current $35 million to support methods of access to other forms of care, including procedures. And we're in conversations with the legislature right now about requiring private insurance to cover medication abortion as well when it's prescribed off-label. All this is in addition to actions we laid out in my proposed 2024 budget, which increases the Medicaid reimbursement rights for reproductive health services, provides more funding for providers, and allows pharmacists to prescribe birth control, as well as implementing data privacy protections and expanding abortion access on SUNY and CUNY campuses. We'll always protect access to reproductive health care and all individual rights here in New York. It's part of our legacy. And in fact, abortion was legal here in New York 3 years before Roe v. Wade was even decided. So as long as I'm governor, New Yorkers will have access to the care they need when they need it. And we'll continue to open our arms to all people seeking freedoms and autonomy. And it's important that we're still fighting this fight yet again. But here we are with all of you, our partners, suiting up for battle in partnership. Let's continue and let's win this fight. Thank you, everyone.